Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health. I'd like to introduce Austin Mills from Benefis Health System in Great Falls, Montana. Today, she's going to share with us her program or her project that included implementing a remote patient monitoring system. So thank you, Austin, for being here. Please share with us, what problem were you trying to solve and how did you go about that with your remote patient monitoring system?
Yeah, so back in 2018, when I kind of first started my quality role with our provider practices, we noticed that our blood pressure control was not that great. We were about 58% for our primary care patients that were at less than 140/90. So we looked for different grant opportunities, and there happened to be one that involved implementing blood pressure monitoring, as well as giving out blood pressure monitors to loan out. So we received that grant and we started that in 2019. My staff member, who has been amazing, has really took that from the ground running and was doing everything manually. So she was calling the patients every week or bi-weekly. She was, taking their handwritten blood pressure logs and putting them into our EHR and sending them to the providers. And so just that process, while it was very great work, was not very efficient. So we, as a health system, we had looked at different remote patient monitoring companies and how do we utilize that within our system. So we decided to implement one and take that on, and we really started that in 2021. So we try to plug in the places that we were already doing this type of care with that technology. And so we started offering the patients, when they got signed up for the hypertension program, to download the app, and then they enter in their biometric data and they answer different questions. And they also have the option to message us different questions, which has been really great for the people who primarily our population that are still in the workforce. They don't have time to play phone tag with us or call during their working hours. So it has been really great, not only just for the case manager, but for the patients and then the providers as well.
Mm-hmm. And what goals did you have when you started the program? What were you hoping to accomplish?
So the main goals were just trying to obviously improve patient care and outcomes, really try to utilize our limited, staff availability to be as efficient as possible. And also just trying to also look at different ways that potentially we could decrease costs for the patient as well as our organization by potentially reducing ED visits or admissions or readmissions.
Great. And what results did you end up finding?
So we found that once we started with the remote patient monitoring program with our hypertension program, we were able to try to expand that to different areas. So for example, we expanded it into our total joint program. So historically, we've had an awesome navigator who does really great with education and getting those patients, before surgery and after. With the Medicare rules that changed, and so it allowed us to do a total hips and total knees on an outpatient basis. So we found that between 21 and 2022, we had a significant increase in the amount of total joints that were going home the same day or less than 24 hours. So we use this as an opportunity to allow all those patients to download that app and then have that kind of sense of security going home that same day, which may be a little bit scary for someone who just got out of surgery, and then knowing that they have someone to reach out to via messaging, as well as us tracking their questions, and then us doing any interventions based off of what they answer, as well as giving educational tidbits or videos, or to make sure that they are properly, using their TED hose or they've taken their medications appropriately. And so typically we do that for 9 days post-op. We have a lot of patients who want to be on longer, which is totally fine. So we just do kind of whatever the patient wants.
Great. And I know you're collecting some data on your results. Can you share that with us?
Yes. So with the wide array of different conditions that we do monitor, it's kind of hard to, just have one data set. But the one that we are tracking across all systems is just patient satisfaction. So at the end of the program, we offer a patient satisfaction survey to them. One of the questions is, overall, I'm satisfied with the remote patient monitoring program. And so far, we are consistently about at a 94% for either they agree with that or they strongly agree.
Great. And your hypertension numbers?
So with the hypertension, like I said, when we started, we were at about 58% for the previous year before we started the grant. For the last 3 years, we have been exceeding the measure up, pressure down benchmarks, and we have been at 81 to 82% hypertension control for our primary care patients.
Wow, that's great. And I think you mentioned that it really did help with efficiency in among your staff. Can you share some about that?
Yes. So of course, no one wants to, bring in or take manual logs or scan them in or then have to retype them up. So it's been super nice for the patient to enter in their biometrics, whether it's manual or whether it's a Bluetooth device. We have a portal that the staff check daily that has all of their parameters. It also shows them, if there's a medium alert in yellow or if there's a high alert in red, so that the case manager, nursing staff can prioritize who they need to respond to first. And then on a weekly basis, those biometric data results feed or flow into our EHR. And then if the provider needs to see those, then they can have access to them. And we try not to bug the providers as much as possible. So we try to take care of anything that we can as a nursing staff and really try to only involve them if needed, just to try to prevent fatigue on the patient or on the provider side.
Yeah, so it really helped you encourage workflows that your staff works to their licensure, right? So it stays with the nursing staff when that's appropriate, and then it escalates up to the provider when needed?
Yes.
Great.
Because a lot of it has to do with just education on making sure that they're taking their biometrics appropriately, or maybe they haven't taken their medications yet or whatnot.
Great. So what advice would you have for others who are interested in setting up a remote patient monitoring program?
So the advice that I would have was be basically trying to start remote patient monitoring for activities that you're already doing. So we had already had a blood pressure program at that time, so implementing it there. We already had a total navigation program, implementing that technology there, as well as just making sure that you're very upfront with the patients about the expectations. So it's at our health system, it's not a 24/7 service. They can put in their biometrics at 3 o'clock in the morning, but we're not going to be checking those until, Monday through Friday, 9 to 4 p.m. So just trying to make sure that, and then also making sure that they know what to do if they do get a reading outside of that time frame, calling that either provider on call or going to their nearest walk-in or emergency department.
Great. So overall, you feel like it was a really good decision for your organization to implement this program?
I do. And we are just still trying to figure out how we utilize it in more areas, especially from the post-hospital perspective or post-surgical areas.
Great. Well, I want to thank you very much for being willing to share your story with us today, and have a great rest of your day.
Thank you.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you so much.